Chapter 6, Regulations and Standards. Introduction. Sterile processing technicians operate within a complex and critical framework of regulations, standards, and guidelines. These rules are never arbitrary. Instead, they are meticulously designed to protect patients from infection, shield workers from occupational hazards, and safeguard the environment from toxic chemicals. Navigating this regulatory landscape requires more than just memorizing a list of acronyms. It requires a deep understanding of not only what the rules are, but also who creates them, why they exist, and the consequences of failing to follow them. In the healthcare industry, requirements generally fall into three distinct categories. It is vital for a technician to distinguish between them. The first category is regulations. Regulations are mandatory rules issued by administrative agencies that have the force of law. Because they are laws, compliance is not optional. If a sterile processing department fails to comply with a regulation, the consequences can be severe. Non-compliance can result in substantial fines, legal penalties, or even the forced shutdown of facility operations. Examples of agencies that issue these binding regulations include the Occupational Safety and Health Administration, or OSHA, the Food and Drug Administration, or FDA, and the Environmental Protection Agency, or EPA. The second category is standards. Standards are uniform methods of defining basic parameters for processes, products, services, and measurements. Unlike regulations, standards are often developed by professional associations rather than government bodies. A prime example is the Association for the Advancement of Medical Instrumentation, or AAMI. While standards are technically voluntary, their importance cannot be overstated. A standard may become mandatory if it is adopted by a regulatory agency or written into state law. Furthermore, standards are used to measure the competence of a department during inspections. The third category is recommended practices. These are documents that reflect the state-of-the-art best practices in the field. They imply what a technician should do, rather than what one must do legally. However, following recommended practices is crucial for patient safety. In liability cases or lawsuits, these practices are often used to establish the accepted standard of care. If a facility ignores these recommendations and a patient is injured, the facility is often held liable for negligence. We must also understand the regulatory agencies themselves. Regulatory agencies are government bodies with the legal authority to issue and enforce regulations. They exist at the federal, state, and local levels. For the Sterile Processing Department, federal agencies set the baseline requirements that all facilities in the United States must meet. However, there is a golden rule regarding jurisdiction that every technician must know. If a state or local regulation is stricter than a federal regulation, the facility must always follow the stricter rule. You can never choose the easier path. You must always choose the path that offers the highest level of protection. Having established the broad categories of rules, we now turn our attention to the specific federal agencies that govern sterile processing. The first and arguably most powerful agency we must discuss is the U.S. Food and Drug Administration, or FDA. The FDA acts as one of the primary gatekeepers of the healthcare industry. Its mission regarding sterile processing is clear. It ensures that medical devices, sterilants, and cleaning products are safe and effective for patient use. To achieve this, the FDA regulates the manufacture of all medical devices and requires manufacturers to provide strict instructions on how to process them. The FDA classifies all medical devices into one of three categories based on the level of risk they pose to the patient. This classification is critical because it determines the level of regulatory control applied to the device. Class 1 devices represent the lowest risk category. These devices are subject to what are called general controls. Because their failure poses little threat to patient life, most Class 1 devices are exempt from stringent pre-market notification requirements. Common examples of Class 1 devices found in your department include basic handheld surgical instruments like scissors and forceps, as well as ultrasonic cleaners. Class 2 devices pose a potential risk to the patient and therefore require special controls and performance standards. This category includes many of the critical tools used in sterile processing, such as steam sterilizers, ethylene oxide sterilizers, biological indicators, chemical indicators, and packaging materials. For these devices, manufacturers are usually required to submit a 510(k) pre-market notification. This submission must demonstrate that the new device is substantially equivalent to a device that is already legally on the market. Class 3 devices represent the highest risk. These are devices that support or sustain human life or are of substantial importance in preventing the impairment of human health. Because the risk is so high, these devices are subject to the most stringent regulatory category called pre-market approval, or PMA. Manufacturers must provide robust scientific evidence of safety and efficacy before these devices can be sold. Examples include heart valves, pacemakers, and infant radiant warmers. Beyond classification, the FDA strictly regulates the instructions for use, or IFU. The FDA requires medical device manufacturers to provide clear, validated instructions. It is the manufacturer's responsibility to validate that their cleaning and sterilization instructions actually work in a laboratory setting. However, it is the user facility's responsibility, meaning the sterile processing technician's responsibility, to verify that they can replicate those instructions. You are legally and ethically obligated to follow the manufacturer's written IFU strictly. If a technician decides to deviate from the IFU and a patient is injured, the facility is liable for that injury. The FDA also manages the MedWatch program, which is a safety information and adverse event reporting system. This program allows healthcare professionals to voluntarily report serious problems. However, under the Safe Medical Devices Act of 1990, hospitals are legally required to report device-related deaths to both the FDA and the manufacturer. Serious injuries must be reported to the manufacturer, or to the FDA if the manufacturer is unknown. Finally, we must address the regulation of chemicals and single-use devices. The FDA regulates liquid chemical sterilants and high-level disinfectants used on critical and semi-critical devices, such as the glutaraldehyde used for endoscopes. Regarding single-use devices, or SUDs, if a device is labeled single-use only, it generally cannot be reprocessed by a hospital sterile processing department. If a facility wishes to reuse these devices, they must comply with the same strict regulatory requirements as the original manufacturer. Consequently, most hospitals do not do this in-house but instead outsource this task to FDA-regulated third-party reprocessors. While the FDA regulates the products we use, another agency plays a pivotal role in defining how we use them to prevent infection. This agency is the Centers for Disease Control and Prevention, or CDC. It is critical to understand a key distinction regarding the CDC. Unlike the FDA or OSHA, the CDC is not a regulatory agency. This means it does not have the legal authority to issue fines or directly penalize facilities for non-compliance. However, you must not mistake this lack of direct authority for a lack of power. The influence of the CDC is so significant that its guidelines are considered the established standard of care. The CDC's primary role in sterile processing is to prevent and control disease, injury, and disability. For our department, the most critical document published by this agency is the Guideline for Disinfection and Sterilization in Healthcare Facilities. This document is widely regarded as the definitive resource for our protocols. Although the CDC guidelines are voluntary in a technical sense, other powerful agencies like the Joint Commission or the Centers for Medicare and Medicaid Services rely heavily on them. If these inspecting agencies find that a facility is failing to follow CDC guidelines, the facility may lose its accreditation or its federal funding. Therefore, compliance is essentially mandatory. The CDC focuses on several key areas, including hand hygiene protocols, isolation precautions for contact, droplet, and airborne transmission, and the classification of disinfection methods that support the Spalding classification system. We now move from infection prevention within the hospital to the movement of materials outside the hospital. This falls under the jurisdiction of the U.S. Department of Transportation, or DOT. The DOT is a federal agency dedicated to ensuring a fast, safe, and efficient transportation system. For the sterile processing technician, DOT regulations become legally binding the moment healthcare supplies or soiled instruments leave the facility and travel on public roadways. This is a common scenario for hospital systems that transport instruments from off-site clinics or satellite locations back to a central processing facility. Under DOT regulations, soiled surgical instruments are classified as hazardous materials because they are biohazards. The DOT enforces strict laws regarding how these items must be labeled and contained to protect the public and the drivers. You cannot simply place soiled instruments in a plastic bag and drive them across town. The regulations mandate specific containment standards. Containers used for transport must be rigid, puncture-resistant, and leak-proof. Furthermore, they must be clearly marked with the recognizable biohazard symbol and the word biohazard. These rules ensure that if an accident occurs during transport, the hazardous contents remain contained. It is also important to note that most state and local laws regarding the transport of medical waste are modeled directly on these federal DOT standards, creating a uniform requirement for safety on the road. From the transportation of hazardous materials, we move to the protection of the environment itself. This is the domain of the U.S. Environmental Protection Agency, or EPA. The EPA is a regulatory agency responsible for writing and enforcing regulations based on laws passed by Congress. For sterile processing, their authority covers three main areas: chemicals, air, and water. First, we must clarify the regulation of chemicals. As we discussed, the FDA regulates high-level disinfectants used on medical devices. However, the EPA regulates disinfectants used on non-living environmental surfaces, such as floors, walls, and tables. Under the Federal Insecticide, Fungicide, and Rodenticide Act, or FIFRA, the EPA requires all surface disinfectants and sanitizers to be registered. Manufacturers must prove that their product is effective and safe when used according to the label. It is crucial to remember that it is a violation of federal law to use an EPA-registered disinfectant in a manner inconsistent with its labeling. This means if you ignore the contact time or dilution ratios on the bottle, you are breaking the law. The EPA also regulates air quality under the Clean Air Act. This is particularly relevant for facilities that use ethylene oxide sterilization. The EPA sets strict limits on how much of this toxic gas can be vented into the atmosphere to protect public health. Similarly, the EPA enforces the Clean Water Act, which regulates the discharge of pollutants into the nation's waters. This directly impacts what chemicals the Sterile Processing Department is allowed to pour down the drain. While the EPA protects the environment, the Occupational Safety and Health Administration, or OSHA, operates with a single mission: to protect the worker. Operating under the U.S. Department of Labor, OSHA enforces the General Duty Clause. This clause requires employers to provide a workplace free from recognized hazards that are causing or are likely to cause death or serious physical harm. There are several key OSHA standards that directly affect your daily work. The Bloodborne Pathogens Standard mandates the use of personal protective equipment, or PPE, requires employers to offer hepatitis B vaccinations, and enforces engineering controls to protect staff from exposure to blood and body fluids. Another critical regulation is the Hazard Communication Standard, often called the Right to Know. This requires that employees have access to information about all the chemicals they work with. This information is provided in Safety Data Sheets, or SDS. These documents, formerly known as MSDS, must be available for every chemical in the department, detailing its toxicity, health effects, and first aid procedures. OSHA also sets legally enforceable permissible exposure limits, or PELs, for airborne contaminants. This limits the amount of chemical vapor, such as ethylene oxide or hydrogen peroxide, that a worker can breathe over a specific period. Finally, to address chemical accidents, OSHA requires suitable facilities for quick drenching or flushing of the eyes and body. These eye wash stations must be located within the work area and must be accessible within 10 seconds of travel time wherever eyes or body may be exposed to corrosive materials. While OSHA and the EPA focus on physical safety, another federal agency exerts control through the powerful mechanism of finance. This is the Centers for Medicare and Medicaid Services, or CMS. CMS operates within the U.S. Department of Health and Human Services. It is responsible for administering the Medicare program and works in partnership with state governments to administer Medicaid and the state Children's Health Insurance Program. While CMS is primarily an insurer, its influence on hospital operations is absolute. This is because most healthcare facilities rely heavily on government reimbursement to survive financially. To receive payment for their services, healthcare facilities must meet specific quality and safety standards known as conditions of participation. CMS specifically evaluates infection control practices. If a facility has high rates of healthcare-associated infections, or HAIs, CMS may take drastic financial action. They may reduce reimbursement rates or deny payment altogether for treating those infections. In the industry, these preventable errors are often called never events, meaning they should never happen, and the government will not pay for them. To ensure compliance, CMS conducts surveys or inspections. However, because CMS cannot inspect every hospital themselves, they often grant what is called deemed status to accrediting organizations like the Joint Commission or DNVGL. This means that if a hospital passes a stringent survey by the Joint Commission, they are automatically deemed to have met CMS requirements. However, it is important to note that CMS still reserves the right to conduct random validation surveys to ensure these accrediting bodies are doing their job. In addition to these federal heavyweights, sterile processing departments must also comply with state and local laws. Most states have a Department of Health Services, or DHS, that governs the licensure and operation of healthcare facilities within that specific state. These state agencies regulate structural requirements, water quality, and waste management. When navigating between federal and state laws, there is a critical rule of thumb that every technician must memorize. If a state regulation is stricter than a federal regulation, the facility must follow the state regulation. You always adhere to the stricter standard. A prime example of state-level regulation involves the certification of sterile processing technicians. While certification is voluntary in many parts of the country, some states have passed specific legislation mandating it. States such as New Jersey, New York, Connecticut, and Pennsylvania have laws requiring technicians to be certified within a certain time frame of employment. In these states, obtaining and maintaining your certification is not just a professional standard. It is the law. Having explored the mandatory world of government regulations, we now shift our focus to the organizations that define the technical excellence of our profession. While regulatory agencies like OSHA and the FDA enforce the law, professional associations develop the standards and voluntary guidelines that constitute the industry's best practices. It is important to understand the power dynamic here. Although these organizations generally lack the legal authority to fine a hospital or shut down a department, their publications are far from optional suggestions. Inspection agencies like the Joint Commission heavily rely on these documents to evaluate a department's competence. Furthermore, if a patient injury lawsuit occurs, the court will often look to these professional standards to determine if the facility was meeting the accepted standard of care. If you were not following them, you may be found negligent. For the sterile processing professional, the most important of all these voluntary organizations is the Association for the Advancement of Medical Instrumentation, or AAMI. AAMI is a non-profit organization made up of a diverse group of healthcare professionals, manufacturers, and government representatives. They collaborate to develop the consensus standards that drive our daily operations. AAMI sets the specific, detailed standards for decontamination, disinfection, and sterilization practices. Among their many publications, one document stands above the rest. It is ANSI/AAMI ST79, titled Comprehensive Guide to Steam Sterilization and Sterility Assurance in Healthcare Facilities. This document is widely considered the Bible of sterile processing policies in the United States. It is the primary reference you will turn to for almost every question regarding steam sterilization. In addition to ST79, AAMI publishes other critical standards. ST91 covers the processing of flexible and semi-rigid endoscopes, a growing area of concern for infection prevention. ST58 covers chemical sterilization and high-level disinfection. AAMI standards are also the foundation for your professional certification exams, such as the CRCST. You will often see the acronym ANSI paired with AAMI. ANSI stands for the American National Standards Institute. ANSI is a private, non-profit organization that administers and coordinates the U.S. voluntary standardization system. It is important to note that ANSI does not develop standards itself. Instead, it accredits standards developing organizations, like AAMI, to ensure their process is fair, open, and consensus-based. When you see the label ANSI/AAMI on a document, like ANSI/AAMI ST79, it means that the standard was developed by AAMI and has been approved by ANSI as an American national standard. This approval gives the document significantly more weight and credibility in the industry, signaling that it represents a true national consensus on patient safety. While AAMI provides the technical blueprint for our processing methods, we must also align closely with the professionals who use the instruments we prepare. This brings us to the Association of Perioperative Registered Nurses, or AORN. AORN is the professional organization for surgical nurses. Since the Sterile Processing Department acts as the primary supplier to the operating room, the relationship between these two departments is critical. You cannot have a functioning surgery schedule without a functioning sterile processing department. Because of this close link, AORN develops recognized standards and recommended practices for the operating room, many of which directly overlap with our functions. Their comprehensive publication, The Guidelines for Perioperative Practice, includes detailed sections on instrument cleaning, packaging, and sterilization. Ideally, the standards for nurses in the operating room and technicians in the sterile processing department should mirror each other. To ensure this consistency, AORN and AAMI usually collaborate effectively. This alignment ensures that patient safety protocols are seamless from the decontamination area to the surgical table. Another vital partner in our mission is the Association for Professionals in Infection Control and Epidemiology, or APIC. This is a voluntary international organization dedicated to the prevention and control of infections. Its members are known as infection preventionists, or IPs. In the hospital ecosystem, infection preventionists act as detectives. They are responsible for investigating outbreaks of healthcare-associated infections. They track the data, identify trends, and hunt for the root cause of infections. IPs work hand-in-hand with sterile processing leadership to develop policies and procedures that comply with CDC guidelines. This collaboration is never more critical than when a problem arises. If a sterilization failure occurs, the infection prevention department is immediately notified to assess the risk to the patient. They help determine if a recall is necessary and what steps must be taken to prevent harm. They validate that our cleaning and sterilization processes are not just theoretical, but are effectively protecting patients in the real world. We now expand our view beyond the borders of the United States. In an increasingly connected world, medical devices are manufactured and sold globally. The organization that oversees this international consistency is the International Organization for Standardization, or ISO. Based in Geneva, Switzerland, ISO is a non-governmental global organization. It creates standards to facilitate the international exchange of goods and services. While AAMI is focused on the United States, ISO standards are global. This is critical for medical device manufacturers who sell products internationally, as they must comply with ISO standards to do business. There are several key ISO standards that impact our field. ISO 13485 specifies requirements for a quality management system for medical device manufacturers. ISO 11135 sets the standards for ethylene oxide sterilization, while ISO 11137 covers radiation sterilization. Perhaps most relevant to the daily work of a technician is ISO 15883, which sets the standards for washer disinfectors and cleaning equipment. You may wonder why a U.S. technician needs to know about international standards. The answer lies in a process called harmonization. Many AAMI standards are harmonized with ISO standards, meaning the U.S. standard is adapted to match the international standard. This ensures that a device processed in New York meets the same safety benchmarks as one processed in London or Tokyo. Returning to the domestic front, we must discuss the organization that is most likely to walk through your doors and inspect your work. The Joint Commission, or TJC. The Joint Commission is an independent, non-profit organization that evaluates and accredits more than 21,000 healthcare organizations in the United States. While TJC accreditation is technically voluntary, in reality, it is effectively mandatory for financial survival. Possession of TJC accreditation is a key requirement for receiving reimbursement from Medicare and Medicaid services. Without it, most hospitals would close. The Joint Commission develops its own standards, but during inspections, which are called surveys, they do not work in isolation. Their surveyors will inspect the Sterile Processing Department to ensure strict compliance with manufacturer instructions for use and infection control protocols. They heavily reference standards from AAMI, the CDC, and APIC to evaluate your performance. Perhaps the most significant aspect of a Joint Commission survey is that it is typically unannounced. They do not schedule an appointment. This means the department cannot simply clean up for inspection day. You must be inspection ready every single day, adhering to regulations and standards as if a surveyor were standing right behind you. From the strict oversight of inspections, we turn to the specialized organizations that manage specific hazards within our environment. The first of these addresses one of the most primal dangers, fire. This is the National Fire Protection Association, or NFPA. The NFPA is an international non-profit organization dedicated to reducing the burden of fire and other hazards. This is particularly relevant to sterile processing because our department houses a significant amount of fire fuel. We store large quantities of disposable plastics and cotton or linen wrappers. We also handle flammable chemicals like alcohol and ethylene oxide. The most visible contribution of this agency to your daily life is the NFPA 704 standard. This standard defines the diamond-shaped labeling system used on chemical containers to communicate hazards to emergency responders. The diamond is divided into 4 colored sections. The blue section indicates a health hazard. The red section indicates flammability. The yellow section indicates instability or reactivity. Finally, the white section indicates special hazards, such as oxidizers. Next, we look at the purity of the ingredients we use. The United States Pharmacopoeia National Formulary, or USPNF, creates standards for the quality, purity, strength, and consistency of medicines and food ingredients. For the sterile processing technician, the USP is critical because it sets the standards for water quality. The purified water used in the final rinse of surgical instruments and in steam generation for sterilization must meet strict USP standards. If the water quality is poor, it can lead to instrument corrosion, staining, and even sterilization failures. On a global scale, we look to the World Health Organization, or WHO. As an agency of the United Nations, the WHO provides leadership on global health matters. They publish major guidelines on infection prevention and control and the decontamination of medical devices. These guidelines often serve as a baseline for developing countries and help inform the creation of global standards. Returning to specific medical specialties, we encounter the Society of Gastroenterology Nurses and Associates, or SGNA. This non-profit organization is dedicated to the safe practice of gastroenterology and endoscopy nursing. Flexible endoscopes are widely recognized as some of the most difficult devices to clean and have been linked to numerous superbug outbreaks. SGNA establishes the standards for the safe reprocessing of these complex devices, and their guidelines are often used in conjunction with AAMI ST91. Finally, we address the invisible environment around us. The American Society of Heating, Refrigerating, and Air Conditioning Engineers, or ASHRAE. This international society advances the sciences of heating and ventilation. Their key document for us is ASHRAE Standard 170, titled Ventilation of Healthcare Facilities. This is the primary document defining the parameters for air exchanges, temperature, humidity, and pressure relationships in the decontamination and clean assembly areas. While ASHRAE writes the standard, it is important to remember that these environmental parameters are strictly enforced by the Joint Commission and state health departments. To wrap up our exploration of the regulatory landscape, we must remember that sterile processing is a highly regulated profession. The technician does not work in a vacuum. Instead, you work within a structured framework of laws, which we call regulations, and best practices, which we call standards. It is vital to distinguish between the two. Regulations, enforced by agencies like OSHA, the FDA, and the EPA, are mandatory. Failure to comply with them can result in severe legal action. Standards, developed by organizations like AAMI and the CDC, are technically voluntary but represent the accepted standard of care. Failure to follow them puts patients at risk and opens the facility to significant liability. Success in this field requires a comprehensive understanding of these agencies. The technician must know not only how to perform a task but also which agency governs that task and where to find the reference standards to justify their actions. We will conclude this chapter by reviewing the essential sterile processing terms you must know for your exam. Class 1 Medical Device. These are low-risk devices, such as handheld surgical instruments and ultrasonic cleaners. They are subject to general controls and are exempt from pre-market notification. Class 2 Medical Device. These are devices that pose a potential risk, such as sterilizers, biological indicators, and packaging materials. They are subject to special controls and usually require a 510(k) pre-market notification. Class 3 Medical Device. These are high-risk devices, such as implants and heart valves, which support or sustain human life. They require pre-market approval, or PMA. Medical Device Reporting, or MDR. This is the regulation that requires user facilities to report suspected medical device-related deaths to the FDA and the manufacturer. Regulation. A mandatory law or rule issued by a governing body, such as the FDA or OSHA. Standard. A uniform method of defining basic parameters for processes, products, services, and measurements, such as those published by AAMI. Validation. This is a critical term. Validation is the process by which the device manufacturer proves that a process, like cleaning or sterilization, consistently produces the desired result. Validation is the manufacturer's responsibility. User verification. This is the process by which the end user, or the sterile processing department, demonstrates that they can replicate the manufacturer's validated process in their specific facility. Verification is your responsibility. This concludes our study of Chapter 6 Regulations and Standards.